recognized as good for therapy. Starting as far back as 800 AD in Germany, they had the physically disabled actually take care of therapy animals as part of their therapy. Then Florence Nightingale, in her notes on nursing, recognized how valuable it was for chronically ill patients to have an animal companion, a bird in a cage even, or a small lap dog or something like that. Sigmund Freud used his dogs with his patients in therapy. He had a pair of chow-chows, and one of them used to come, and he noticed that his patients were more forthcoming because the dogs helped relax them and made them feel less threatened. So there's been a long, long history of the animals being used and recognized, and more formal recognition that has come now with the establishment of groups like Therapy Dogs International, which I think was founded in 1989. I'm not certain of the date. There's also a group out in the Northwest called Pet Partners. They used to be called the Delta Society, and they certify not just dogs, but they certify rabbits and horses and llamas and whatever else anybody might bring in that would be suitable. You could have a cockroach or a snake be a therapy animal if you wished, although people would probably run screaming. But again, I mean, a large snake like a ball python, which I actually handle at the zoo, is actually an ideal therapy animal if somebody likes snakes, because they're very calm. They simply wrap around your arm, they want the warmth of your body, and they don't really mind being touched if they're acclimated to it from the time they're first hatched. So it's all over the map. Horses in particular are used as therapy animals in a very specific prescriptive way known as hippotherapy, which has to do with the genus of the horse, Hippocampus. Not hippopotamus. But anyway, the actual movements of the horse are used in physical therapy for the patients involved. It's quite an interesting field.
The human-animal bond starts with you and an animal, your pet, your companion. I hate to say pet now, but you form a relationship. When you touch and stroke an animal, what it does, it stimulates brain receptors and dopamine and serotonin, and it reduces your blood pressure and your heart rate. So that's very good for the health aspects. It also increases your oxytocin levels, especially, well, that's the mother-child bond. Those oxytocin levels increase the bond. It makes it stronger, and that's also increases your serotonin levels. And there's more and more research on it that it's so amazing that makes you want to care and nurture for. And so in the more you have, the stronger it becomes, and the more relaxed. And there's so much biology to it that we're still finding things.
A therapy animal, a potential therapy animal, is going to be an animal who already has a sense of innate calm, and an animal who loves people, just naturally. So you take those natural behaviors and you begin to train them in the basic obedience commands: sit, down, stay, leave it, that sort of thing. A first step for somebody aspiring to be a therapy team would be to take their animal through what's known as the Canine Good Citizens Test. And this comes out of the American Kennel Club and AKC. And it's a program that simply tests your dog to show that the obedience, has taken, and you have a bond with your animal. Well, the bond that an animal forms, particularly a dog, which is a natural pack animal, with its human is simply extended then to the other people who might come, to visit it, or that it visits when it goes there. These dogs naturally gravitate toward people. They like the attention. And for many dogs that are home pets, they don't have a job really. Most dogs need a job of some kind, and they're happier when they're working. You've heard the term a working dog needs a job, and there are some dogs like Border Collies who naturally herd sheep, and they herd children just as effectively. Or the livestock guardian dogs like the Great Pyrenees, or the dog I once had, the Caucasian Ovcharka, they actually do need something to do. And this gives the dog something to do. It's also something for the dog to do with its handler, with its owner as a team. And it's just, the dog loves it. They, get their scarf on, they get in the car, they go to a new place, they get their belly rubbed. The dog gets an enormous amount out of that as well as the humans, so it's not just for humans. What level of training does your dog have? Is your dog innately calm already? Are they jumpy and excitable or nervous? If so, then they might not be a good candidate. But if you think they are, go to our Tony website. Here's a list of local trainers who will help you prepare your dog for the therapy dog testing. A first good step is to get that CGC certificate, and then go on from there and sign up for the therapy dog test. You can go to the calendar on our Tony website, and we do list when testing events are being held there, and you connect directly with the person who's doing the testing.